New videos every day.
Life, wisdom.
What is given to us by the pharmaceutical industry in the drug ads, in the presentation of these drugs to us, is that these are medications, that they are safe, that there is no concern about these drugs, that the use of these drugs is perfectly fine. Those thoughts are a product of the pharmaceutical marketing industry.
Yes.
That is what they want us to believe. That's what they are telling us. That's what they are driving home to us. And if you still believe those things, you are still, toting their talking points.
And that's why I'm saying that, you're talking about psychiatric drugs. Psychiatric drugs are a whole different animal because they're trying to make us believe that a psychiatric drug is just like someone who needs insulin, that this is something the body isn't producing, that you have a quote unquote brain chemical imbalance. Well, that was debunked ages ago by reputable psychopharmacologists. Do your homework.
Right.
They're still saying this because that is the mode of action of the drugs. So if it's the mechanism of action of the drug, then they say, well, this, increases serotonin. Therefore, people who are depressed don't have enough serotonin. But they're not telling you what benefit or what role serotonin plays throughout the entire body, what other body systems that serotonin affects besides just, your mood stabilization. So you cannot take a drug and expect it to only affect one body system because every drug is a toxin. And psychiatric drugs are highly toxic pharmaceuticals. Highly toxic. You cannot take psychiatric drugs and not have adverse events for any length of time. I've never talked to a patient who told me they didn't have any adverse events except for one individual. And she said, I can't feel anything. I don't have any adverse reactions. Well, duh. If you can't feel anything, that's an adverse reaction.
Right.
They're not designed to make you not feel anything, but you wouldn't believe how many people feel clinically dead on these drugs.
When we're talking about our children, and I think that you brought this point up, it really is a question because children don't have any choice here, right? This is the parent giving them the drug, or if they're in the foster care system, perhaps that system is...
They're the perfect expansion market, Karina. I just want to interrupt you and say that. They're the perfect expansion market for the industry because these are the most compliant patients on the planet.
Exactly.
The reason people don't like to take psych drugs is because of the horrendous side effects. I mean, how many movies have you watched besides just One Flew Over the Cuckoo's Nest where they depict patients are hiding their drugs, they're under their pillows, they're cheeking them, they're not taking their drugs? I ask people to think about this logically. If you were out of your mind, hearing voices, seeing things that didn't exist, if you were crazy, quote unquote crazy, and someone was giving you a drug that was making you feel normal, why would you not want to take it? It doesn't make any sense. It's because at some point, the patient determines the drugs are causing the problem. And they feel worse when they're taking the drugs. And so they try to stop taking the drugs because they recognize they get a spiritual innate message that these drugs are causing damage. And they try to stop taking them. Mm-hmm. And that's because they're so highly toxic.
And then when we look at children as a potential drug market,
you're talking about a very compliant patient. And the reason being, their parents tell them to take the drugs. Their teachers tell them to take the drugs. Their caretakers tell them to take the drugs. That means a refilled prescription every single month. That means a compliant patient population that adds more money to the till down the road. That's what pharma wants. They will also try to get your elderly patients in the same manner that are in nursing homes. Why? Because someone comes around every day and gives them their drugs. They're very, very lucrative patients, and they're referred to as cash cows by the industry. And the reason they're cash cows is because they all have medical insurance and reimbursement, because All kids are either on Medicaid or some kind of private insurance, as are your elderly that are on Medicare or some other kind of private insurance. So they're an absolute guaranteed reimbursement.